Hello, this is Eduardo Rubio. I'm a practicing pulmonary and critical care physician in the United States. I'm filming this video to demonstrate a potential alternative for ventilating patients that have developed severe respiratory failure due to the coronavirus 19 disease and are being treated in institutions where no available ventilators are in stock. I want to clarify that I do not imply here that this is a replacement for a traditional ventilator. In fact, I have not tested this with any patients. It does not provide the alarms that a ventilator has. It certainly has many less capabilities. But if you're dealing with a patient that requires intubation and ventilation, this could be a potential alternative. While I accept no responsibility or liability for the use of this, I did want to show you how to set it up, as I think it may be a reasonable consideration if you are having to deal with these circumstances of treating a patient and not having the needed equipment. I have put several pieces together here which are required for the setup. These are traditionally found in your respiratory department. They have 22mm connectors, and I'm also using a heat exchange moisture valve. This valve essentially will be connected to the patient's endotracheal tube, and I'm using this to simulate the lungs. You will use a T-piece, and the T-piece will be connected to the tubing that is connected to the BiPAP system. We're using a BiPAP ST system that allows us to set up a backup rate. We're using this oxygen connector, which has a smaller port that you can see here, and that decreases the amount of leak. Essentially, this will be the exhalation valve. This valve will be also covered by a HEPA filter, and this allows for filtration of particles so that there is no contamination of the surrounding environment. The whole system is easily assembled together and now is well filtered. If you had a concern that the leak is still too high and you wanted to have further decrease in the leak to potentially ensure a more accurate degree of PEEP level, you could always put on top of that a PEEP valve. So the machine should be able to compensate and maintain pressures appropriately. The BiPAP ST system we're using here was set with a rate of 20, pressures of 25/15, and an inspiratory time of 1.5 seconds. It will start functioning now, and you will see how it's allowed to ventilate appropriately with the settings of the rate of 20 and inspiratory time of 1.5 seconds. It's providing an I/E ratio of 1:1. Again, while this has not been tested in patients, it seems as a reasonable alternative, and I just wanted to post this online so that all the physicians would be able to consider this if they're treating patients and they have no available ventilators. I wish you the best of luck. Be safe.